Good morning, everyone. The previous speakers mentioned that the European Commission launched last year consultation on mobile health. I think we have mentioned the big potential of mobile health. It can help patient empowerment, citizen empowerment as to the management of their health, prevention of diseases. It can also help healthcare systems to have more efficiency, help doctors in working, better interacting with patients. So in the context of the green paper, after summarizing, showing the real potential advantages that mHealth can bring in Europe, we also wanted to ask stakeholders about all the barriers. And this is, in this context, we received 211 responses. We published the results last week. 70% of the respondents were from organizations. We also received responses throughout all Europe and also from some countries like the US. So the key results of this consultation, and I will focus on the most essential because there is a series of barriers we emphasized. First of all, privacy and security are key, and it should also be seen as a competitive advantage for companies to tackle this issue. Because in order to really make citizens use the solutions, you need to ensure the trust of the users, and we have seen in reality that it's still not there. Linked to that, there's a problem of compliance with legislation, be it privacy, medical device. It's not at all surprising when we know that mobile health market is led by SMEs. So there's a need of raising awareness about the legislation, clarifying it when it's necessary, and this was mentioned also by entrepreneurs as a key barrier to the market. These triggers, for instance, are drafting of the staff working document on the existing legal framework applicable to lifestyle and well-being apps, which we published with the green paper last year, in order to help SMEs understand better the legal frameworks they're facing at. Then another key point result is that in order to enhance mHealth, you need to have patient safety and transparency of information. The problem is that right now we're dealing with a booming market, lots of solutions covering a wide range of purposes, from prevention to healthcare and medical purpose. So it's not easy for a consumer, for a citizen, to know which one is reliable, which one is working, and whether or not they can trust that their data are safe and not resold to third parties. That's why it's really important to tackle this issue. We mentioned, some speakers mentioned the problem of legal vacuum that is also in this field, because while medical purpose solutions are tackled by EU legislation with the medical devices directive, which are currently being revised, the lifestyle and well-being apps do not have safety requirements. So this is another point that was mentioned. Finally, the web entrepreneur considers that it is difficult to access the markets, and they're asking for legal clarity, help as to funding and accessing the market. So those are the results. And also another point which is really important is we try to gather more evidence on cost effectiveness on mobile health. And while we managed to gather key, I would say, good practices from all the member states, and you can see it in the summary report of the responses to the green paper, we still are lacking a lot of evidence on cost effectiveness, and this is really a crucial barrier for healthcare and public authorities in order to use the solutions. As to what is going to happen now, As to data protection and privacy, there is a need for more enforcement. So the Commission is coordinating and pushing the relevant authorities to do more, and we see it's happening on medical device. It's not so easy because we're talking about solutions that are online, so it's difficult to see enforcement. Also, issue around health data. What is health data? What is not? It's not that obvious. Again, the legislation is changing. So on that point, we raised the need for really clarification to the data protection authorities of Europe, the Article 29 Working Party, so that they are aware that you need to be flexible and you need to really help clarify the situation, also in the context of the reform. As to transparency and patient safety, so we are right now, we just published the responses. We need to do an impact assessment of the series of policy actions that should be preferable. So we need to first assess whether or not there is a need to legislate where there's a legal vacuum. Because what has been showed by our research is that there is no EU legislation on the safety of digital goods in general. So I'm not talking about lifestyle and wellbeing apps, I'm talking about the safety of digital goods. Is it necessary to tackle this legal vacuum or not? Is there a need for safety requirements for this? So this needs to be assessed in the context of the need of a stronger digital single market. As to how we can enable transparency of information and patient safety, we need to go, maybe there is also possibilities of soft regulation and pushing for voluntary schemes towards quality labeling, so that the ones that want to use a competitive market for the solution can do it in a way that enhance information of the users and of the buyers. As for enhancing more evidence on the cost effectiveness and pushing the member states, the Commission is also strongly acting on that. But I'm gonna go into detail because it's not public, but we're gonna really try to work on tackling the issue of evidence at EU level, and this will be announced in the course of 2015. Research is also important. We have seen that research at national and EU level in the EU was really helping the market. Some recent testing has shown that, so we will continue on having a leading role on funding mobile health because it's needed to ensure that the solutions are also more efficient and so on. And so because we are in this stage of the impact assessment, and there is a need of engaging more stakeholders and helping us in the ideas we have of actions, we will launch a series of stakeholder events in this year. One key event will be at the ES Week in Riga. We will have a series of dedicated sessions and a specific stakeholder session on mobile health. As for the other barriers, we can discuss further in the discussion.
Thank you very much.